Right. I'm Nasser Loza. I'm a practicing psychiatrist. I practice in the UK and in Egypt and other parts of the world. I hold a number of positions, but my main one is that I'm director of the Behman Hospital and the Behman Consultancy Clinics, both in Egypt and in the UK. Currently, I'm also president of the World Federation for Mental Health. This is a global association that looks at essentially supporting and advocating for the rights of people with mental illness. I don't know. That's a good question. I came to this world as part of a family of doctors and a family of psychiatrists. It was kind of taken for granted when I was 10 years old, that's many years back, that I would follow the family tradition. I was born in a hospital and I grew up in a medical environment. So that's just the life I knew. That's what I know what to do, really. Probably goes along the same lines. I mean, my family were all psychiatrists, my father, my grandfather, an uncle and a sister. That's just part of life, and when I was a teenager and lived at home with my parents, and there were no mobile phones then, my father, helped his clients on the telephone. And I grew up listening to psychological support and how things are done. That was just part of life. Every morning, my dad had a couple of hours of that. So that was just my life. There wasn't a moment when I chose to be a psychiatrist. It was just, how I grew up. Oh, it's what I find rewarding about psychiatry, clinical psychiatry, that is the sense of helping people go through life. I try not to be of help just over an hour's consultation in the office or online. I'd like to think that I help people way beyond that. But in recent years, because of my work with human rights of mental patients and drafting legislations in parliament for laws to protect people with mental illness, what I really find rewarding is this shortcut. Really, you reduce stigma in mental health. You help many more people in a much shorter time. So this is where my heart lies today, in the clinical work and in advocacy and anti-stigma campaigns. Well, I guess they'll be the right ones to ask about that. But I imagine my availability and my sense of helping people through their lives. In the old days, we used to be able to do domiciliary visits and visit our clients at home. That's not possible anymore in today's world, particularly after COVID. But with online, we do a lot of that. So I think they value the fact that I'm there, whether I'm traveling or not, I will respond. And that's part of my job, really. I hope that we will be helping and supporting individuals with mental health problems in the same respectful and caring ways that we would like to be treated should I get through a difficulty of time or suffer from mental health difficulties. I would like to be in a caring society. I would like to have people respect my pain and support me for that. So that's what I'm aiming for. Yeah.